I'm going to ask the big question. And
Oh.
how did you go with COVID? How was nursing in COVID?
Well,
You just opened a can of worms.
Yes.
Yeah, literally.
I think lately, anytime anyone has ever asked me like, "Oh, how are you going?" Literally, my first answer is, "I'm tired,"
Yeah.
which I think says a lot for every single nurse
Yeah, most
at the
definitely.
moment, and any health professional that is,
Yep.
regardless. It's been very challenging.
Yeah.
It's been mentally challenging in ways that I don't think anyone in the health profession thought it was going to be. We are lucky in a way that we got to see how it sort of unfolded overseas prior to it really coming and hitting hard here. But in a way, it also didn't really affect how intense it smacked everyone in the face.
Yeah.
Mm-hmm.
You say there was challenges. What do you think was one of or a couple of the biggest challenges?
Other than, I mean, when you think about it, a lot of the people who come into my career do it because they love looking after people. They're very big people.
People.
You have that
people
compassion.
persons.
Yeah.
And a lot of that was taken away because when you've got COVID, you're in a single room and the nurse will come in with all their PPE on.
Yeah.
But you kind of get in there, you do the job that you need to do, and then you get out as quick as you can.
It's
Yeah.
not
Lost the personal touch.
Yeah.
that patient, like health professional relationship's no longer there, and the rapport
Absolutely.
can't be built. Yeah.
And even for patients that are passing away, you know, one of the biggest things that you learn when you're at uni or whatever education you're going through to be a nurse, you know, just that person-to-person touch of being able to hold someone's hand when they die
Yep.
means so much that was even being taken away from us because of all the PPE, and it's just not very personable, and your family can't be there because you're dying. So I think, you know, seeing people pass away on a regular basis in our profession is hard enough as it is, but not being able to support patients as much as you want to
Yep.
because of the social distancing and everything like that has just rocked a lot of people. And I think a lot of people have suffered mentally a lot for that.
Yeah, like you've lost that sort of sense of empathy and the ability to be able to have that social connection. And yeah.
But I mean, other challenges are, which if you listen to the news, ratios in our hospitals has been a massive thing. So on the 15th of this month, New South Wales Health and, the Nursing Union of New South Wales declared an industrial action strike.
Yep.
So a lot of nurses walked off the job for the first time in almost a decade.
It's incredible.
To march to Sydney Parliament House and basically try and get their voices heard for ratios and patient care and everything like that. Because it's a massive issue, and it's been something that's been an issue prior to COVID anyway.
Yep.
And I think that that's something that a lot of people don't understand, because we hear on the media of, you know, there's no beds and there's no this and there's no that, and because of COVID and all this sort of thing. This has been happening well before COVID, but we just don't hear about it.
Yeah.
When you say ratios, what do you mean by ratios?
So when we talk about ratios, we're talking about how many patients are being looked after by one nurse at a time. Right. So in New South Wales, we don't actually have, in the public system, neither in the private system, but we don't have any governed ratio system
So
whatsoever.
there's no legal stipulation that you have to have. Yep.
No. So in Queensland, lucky them, they get to have at least one nurse to 4 patients on like a surgical ward or anything like that. We don't have anything like that here in New South Wales. We try our best to be able to do the 1 to 4, but a lot of times you'll walk onto a ward and because they're so short-staffed, you're having one nurse looking after like 6 patients, which can become extremely unsafe. But during the strike and all of the action that the nursing union and the members have been doing over the last couple of months and years, we're trying to get ratios for at least 1 to 2 in HDU. So HDU is the high dependency unit in ICU. 1 to 3 in ED, hello, and 1 to 4 on the wards as well.
And like if you had to gauge it, what is it now roughly, the ratios?
Well, like I said, on like medical and surgical wards, a lot of the time you're having one nurse to 5 or 6 patients. ED, the emergency departments is just horrific. It's definitely not 1 to 3. And even ICU, especially during COVID time, because they've been having a lot of COVID patients and things like that, they're being stretched a lot more thin than they should be as well. And in those areas in ICU, you want to have one person looking after one ICU patient, and you want one person looking after 2 HDU patients, because they're our sickest patients. I think we're so lucky to live in Australia and have an excellent healthcare system and being able to have first world healthcare, but it's still not good enough.
Yep, most definitely.
Yep.